Welcome everyone to today's session on accounting for sex and gender in research. My name's Nikki Hopkins and my pronouns are she, her, and I'm one of NIHR's Research Inclusion Managers.
Hi everyone, my name is Emma Hadfield Hudson, my pronouns are she, her, and I'm also one of NIHR's Research Inclusion Managers.
Okay, so today our session is going to cover the background to NIHR's inclusive research design requirements, the rationale for accounting for sex and gender as a condition of funding, what the requirements are for accounting for sex and gender in research, what we mean by sex and gender, and how to account for sex and gender across the research cycle, and then finally where to seek further information and guidance. So I'm going to start with the background. So NIHR's mission is to improve the health and wealth of the whole nation through research. However, it's impossible for NIHR to actually achieve this without first addressing health inequalities and ensuring that the research that we deliver addresses the health needs of everyone in society. So health inequalities are unfair and avoidable differences in health across the population and between different groups in society. Certain groups of people often experience poorer health outcomes and other groups in society. Simultaneously, these groups have been historically underserved by research. This situation means that the findings of health research are often not transferable to the people who stand to benefit most from it, and it allows health inequalities to continue and even worsen. So by introducing inclusive research design and sex and gender conditions of funding, we can actually ensure that research is designed, conducted and communicated inclusively, which will not only address health inequalities, but it will result in other benefits, including better science. So the first stage of our inclusive design requirements was our launch in November 2024. So this was implemented. This required applicants to formally describe their approach to inclusive design across the research lifecycle and costs for these inclusive design components. Embedding inclusive research in NIHR's funding is a long-term piece of work with 3 overarching projects which set out to create funding requirements for inclusive design, sex and gender, and in the longer term, ethnicity. And we will be applying these requirements to all categories of NIHR funding where it's feasible and practical. So in the first instance, we're focusing on our domestic programmes. And in order to make these changes effective across our domestic programmes, we will be making amendments to our application and guidance, to our committees and decision-making processes, to our award monitoring processes. And all of these changes will be underpinned by clear comms and engagement, training and support offer for all of our stakeholders, and then monitoring and evaluation of the process to make sure that we are learning from the changes we make. So in November 2025, we'll be launching the second phase of these requirements by introducing specific sex and gender requirements in domestic programmes. And that's what we're going to hear to talk about today. So these requirements launch on the 10th of November 2025. And from this date, applicants will need to consider inclusive design broadly, thinking about any characteristics or groups relevant to their work, as well as sex and gender specifically. The other stages and phases that you can see on the slide will be rolling out in the coming years, but there'll be clear communications for each stage. So now I'm briefly going to talk about why we can bringing out the sex and gender requirements next. So in 2022, NIHR's Research Inclusion Strategy committed us to developing an approach which ensures our research community account for sex and gender in research. And we reinforced this commitment in our blog and statements of intent in 2023, where we publicly committed to developing a policy approach to sex and gender in research. Also in 2022, the government published the Women's Health Strategy for England, and that detailed how the government, along with NIHR, have a long-term aim to explore how we can encourage researchers to disaggregate research findings by sex. Central to the development of this sex and gender policy has been our participation and engagement with the Message Project. And this championed a sector-wide approach to this work. And we've got Alison Kay from the Message Project with us here today to give us a little bit more detail about the project and why researchers need to account for sex and gender. So I'm going to hand over to them now.
Thanks so much, Nikki. Hello, everyone. My name is Kate Womersley, and my pronouns are she, her. And this is Alice Witt.
Hi, everybody. My name's Alice Witt. I'm the Policy Fellow for the Message Project, and my pronouns are she, her.
So I'm co-principal investigator of the Message Project at the George Institute for Global Health. And Message stands for Medical Science, Sex and Gender Equity. So we're going to speak today about how the Message Project has worked with NIHR to co-create the sex and gender policy changes. Thanks, Emma. Next slide. So there's a growing body of evidence which highlights how sex and gender play fundamental roles in a person's experience of health and of illness. It influences, or they both influence, how conditions may develop in different people, how those people then present with different diseases and conditions, how they're treated by clinicians and the interventions they might or might not be offered, their experience of being ill and how society responds to that, and ultimately their outcomes in terms of morbidity and mortality. Poor accounting for sex and gender in research translates into gaps in the medical evidence base and therefore into healthcare outcomes for all people, but particularly for women and sex and gender diverse people. Next slide, please. There has been, and there continues to be, an international male bias in science and medical research. In preclinical research, over 5 times more male cells in animals are used in bench science compared to females. And in clinical research, over 70% of participants are not just men, but they are white men. And this was barely remarked upon for decades. The majority of UK-funded research doesn't currently account for sex and gender dimensions in terms of recruitment and then appropriate analysis of the data to detect any sex and gender differences. As ever, there are some people who may want to continue doing research the way it's always been done, but we're here to tell you that the costs of that are just too high. And we're really delighted to see NIHR contributing to that change. Next slide, please. So here are just a few examples across medical specialties where sex and gender have a noticeable effect. So autism used to be thought of as a condition which overwhelmingly was relevant to men and boys. But when sex and gender specific diagnostic criteria were used for diagnosis, the ratio of autism diagnoses between men and women changed from 10-1 to 3-1. And this shows that the traditional criteria may have missed how autism presents in women and girls, leading to underdiagnosis. Then in terms of data on the effectiveness of beta blockers, which are a common medication prescribed in many scenarios, but after a heart attack, and have been for over 4 decades. But that data has only recently been separated by sex. So the Reboot study showed that women treated with beta blockers, which was meant to be helpful, was meant to improve their outcomes. Actually, these women were almost 3 times more likely to die than women who didn't receive the drug. And by comparison, no harm was detected for male patients. In psychiatry, which is my specialty as a clinician, antipsychotics are usually prescribed in a sex-neutral way, meaning that the same doses are given to both men and women. However, research shows that women often receive higher doses than they actually need. And so while those doses are effective, they can cause more side effects for women compared to men, which can be difficult for those women to manage, but can also be dangerous. Next slide, please. Optimistically, and we're delighted to see this growing policy movement, which is supportive of change in terms of sex and gender. The Women's Health Strategy for England and the Women's Health Plans of Scotland and Wales state the importance of disaggregating research findings by sex and to ensure greater inclusion of women and other sex and gender groups in research. The NHS hopes to further personalised medicine, and part of that will be a requirement for better data about the influence of sex and gender on health and disease. Meanwhile, this NHS Confederation report highlights the countless conditions where sex differences and gender differences aren't known because the research has not yet been done, which we hope is going to inspire curiosity and excitement among researchers about the findings that are waiting out there to be discovered. So there is this growing awareness that inclusion is important for research value for money, to advance scientific rigor, and to achieve better health outcomes for all. Next slide, please. The UK has been far behind our peer countries in terms of sex and gender inclusion until recently. So thinking about the US, they recognised the problem 3 decades ago. And 1993, there was the Revitalisation Act, which required the NIH, that all studies funded by the NIH did then have to include women. Subsequently, Canada and the EU have introduced policies. But you may be wondering, well, if these policies are in place, do they actually make any difference? And thanks to Haverfield and Tannenbaum, who published an evaluation of the Canadian Institutes of Health Research's sex and gender policy, which has now been in place since 2011, we can see that policies do have a marked effect and a positive effect. So applications for research funding that integrated sex increased nearly 4-fold, and those which integrated gender increased nearly 3-fold since in the 10 years since the policy was introduced. So meanwhile, back in the UK in 2021, our team did some preliminary research, which unfortunately showed that not a single research funder or regulator in the UK had a sex and gender policy in place for the research that they were funding. And so that's where Message came in, and I'll now hand over to Alice to tell us more.
Thanks, Kate. As Kate says, the Message project was created to address this really important gap in UK policies and the wider problem here. Although the UK has lagged behind the other countries just mentioned, we've really had the benefit of the wealth of learnings from these other funders to draw on, which has really shaped the way that we've approached this work. So over 2023 to 2024, we brought together actors from across the research sector to co-design a sex and gender policy framework for research funders. The aim was to establish a joint best practice for the UK research sector that could be used to guide funders in their requirements of researchers, and it could be used by researchers to understand what is needed to account for sex and gender in practice. Next slide, please. Message has benefited from the expertise and input of many individuals across a very wide range of disciplines over the last 2 years. These include equity and diversity and inclusion leads, such as Dr. Esther McCuker and the NIHR Research Inclusion Teams, as well as policy experts like Lillian Hunt at EDIS and Katrina Manville at the Association of Medical Research Charities. We've had experts in biomedical, clinical, epidemiological and social science, as well as philosophers involved, alongside clinical practitioners such as Dr. Raghashree Dariwan and Dr. Michael Brady from NHS England. We've also benefited from wider investigator and advisory groups. And this breadth of expertise has really been imperative for producing robust policy, but also ensuring buy-in across the UK health and research sectors. Next slide, please. Message took a novel approach that scales up impact right from the outset. Instead of multiple funders having to each invest time and resources in designing a sex and gender policy, we've convened not only a large group of funders, but a group of stakeholders representing the whole UK research sector to produce a joint best practice. The NIHR have been a key partner throughout this work, as have the UK's other government health research funder, the Medical Research Council. A number of charitable funders have also been key to the process, particularly those under the Association of Medical Research Charities. These have included Wellcome, Cancer Research UK and the British Heart Foundation, as well as smaller charities such as Fight for Sight and Epilepsy Action. Academic publishers, including The Lancet, the BMJ and PLOS Medicine, were also represented, as well as the UK's key regulators, the MHRA, the HRA and NICE. Importantly, the labs were attended by patients and people with lived experience of different sexes and gender identities, researchers across a diverse range of relevant disciplines, and officials from the Department of Health and Social Care and NHS England. This approach ensures not only that the policy framework draws on the knowledge of the UK's key experts, but also that it's grounded in pragmatic considerations regarding funding processes. Moreover, it ensures that the research funder policies are well tailored to publisher and regulator needs, so that expectations can be mirrored across the research pipeline over time. This is really important for ensuring that expectations of researchers are consistent, helping researchers to upskill in these key concepts and reducing the administrative burden of applying for funding. Next slide, please. Our co-design process centered on a series of 4 day-long policy labs. Policy labs are workshop-style events that bring together key stakeholders from a range of backgrounds and follow a particular methodology to think through a problem and find real-world solutions. The methodology is focused on creating an open, inclusive space with an emphasis on collaboration. The first lab focused on hearing stakeholders' vision for this work, including their perceptions of the gaps that needed to be filled, the challenges they anticipated, and importantly, taking a solution-focused approach to those anticipated barriers. We were all really struck that day by the palpable excitement of stakeholders coming together, realizing that their peer organizations were also interested in making change happen on this issue, and finding that in Message there was this vehicle for establishing a joint best practice for rigorous science around sex and gender. We came away with a really strong sense that it was about how, not if, this work should be done. Following the first lab, we drafted a policy framework using the information that the stakeholders had shared, as well as lessons from those other countries that were mentioned and consultation with experts. Policy Lab 2 involved an in-depth review of the framework content and working through some of those particularly knotty issues to establish a consensus on the guidance that we'd include in the framework. Following this, we incorporated all of that feedback into the framework to produce the final document in April of 2024. Policy Labs 3 and 4 covered implementation and evaluation of sex and gender policies, respectively. In particular, we discussed a 5-year roadmap for sector-wide change, over which time policy requirements will move from being strongly recommended to mandatory, and that's across the sector, meaning applications which don't adequately account for sex and gender will be rejected. Conversations also centered on how publisher and regulator requirements of research will move to reflect funder policy requirements over time to ensure that those same expectations are made of researchers throughout the research pipeline. Next slide, please. So those policies are now being rolled out based on the Message framework, including the NIHR's fantastic new sex and gender policy. Upskilling the research sector to meet new policy requirements has always been a priority of the Message project, and you can access a free e-learning module on our website, messageproject.co.uk. The module takes you through key principles to consider when designing a research study to account for sex and gender at every stage. You may also find it useful to review the policy framework itself, which contains detailed guidance on what is needed to account for sex and gender in practice. It addresses questions covering sample size design, study power, and acceptable or unacceptable justifications for not accounting for these key variables. Lastly, we're excited to share that we'll be launching a short course integrating sex and gender in health research and policy, which will be run through Imperial College London from early 2026. This is aimed at any health and care researcher in the UK who is keen to ensure rigor, reproducibility, and equity in their study design. Last slide, please. Our many thanks to the NIHR for their partnership on this work and for delivering a policy which will have such meaningful impact on health and care research and ultimately on the health outcomes of all people in the UK. Our thanks also to the very many people who've been involved in the Message project so far. Thank you, and I'll hand back to Nikki and Emma. Thanks.
Thank you, Alice and Kate, for really setting the scene there and really showing us what the rationale for this work is. What I'm now going to talk in detail about is what NIHR's actual requirements are and what we'll be expecting researchers and applicants to do as a condition of funding. So we've developed and published NIHR's first sex and gender in research policy, and this formally sets out our requirements for sex and gender in research, along with how we use the terms sex and gender. Now, the policy requirements will only apply to domestic awards, and they'll be rolled out within the One NIHR system from the 10th of November 2025. The following processes will be impacted and have been amended accordingly. So we've amended the application guidance, the reviewer and committee forms and criteria, and our monitoring processes. And all the amendments made have been informed by the policy requirements. So what does the NIHR sex and gender policy actually include? So like I mentioned, this is NIHR's first sex and gender in research policy, and it's very much based and been informed by the Message policy framework, which you've just heard all about. So that creates the foundation for NIHR's policy. The policy itself covers a number of areas, and this includes the purpose and scope of the work, some detailed terminology, including how to use the terms sex and gender, and then the specifics of the requirements for both funding applications and award monitoring. We've taken a very much inclusive approach to the policy, and an important aspect of that has been recognising that sex and gender are separate and multifaceted concepts. They're used and understood differently in different contexts, societies, groups and languages, and sometimes inappropriately used interchangeably in research. So NIHR's policy recognises the complexity of these concepts and ensures that all sexes and genders can be considered in research. So the key thing is that the policy fully explains in detail how researchers should use the terms sex and gender. It also details the different sex and/or gender characteristics researchers need to consider when recruiting research participants, along with specific requirements for disaggregating this data. The application guidance, which I'm going to talk more about shortly, provides much more detailed information about how researchers can meet the policy requirements. And then the committee and peer review assessment criteria, which I'll also touch on shortly, provides the core areas committees will assess applications on. So this policy is available on NIHR's website, and the link's provided in the slides for you to be able to access that. So the policy clearly outlines which domestic programmes and processes are in and out of scope for this initial launch. So just to clarify, the out of scope for this 10th of November 2025 launch are NIHR Research Infrastructure and Consortium funding calls, global health research programmes, applications for personal career development awards without a research plan, but to note those with a research plan are in scope and the policy does apply, and any NIHR research that's funded prior to the policy launch date of the 10th of November 2025. We will, however, be doing further scoping to understand how and whether we can roll out the sex and gender requirements to these other areas in the future, and we'll communicate that widely as we progress with that work. So to understand more about the requirements, you'll find brief details included in the application form at both outline and full application stages. This then links out to a separate web page where we've then built in more detail about the requirements. The webpage is titled Inclusive Research Funding Application Guidance, and we introduced this in 2024 when we rolled out the Inclusive Research Design conditions of funding. And what we've done is built the sex and gender requirements into that page. Importantly, the guidance now has a specific section on expectations, which covers justifications for single sex and single gender research. It also includes specific requirements for collecting demographic data for sex and gender, and for including data for specific sex and gender characteristics. And then to support the policy, we've brought in new committee assessment criteria that incorporates those sex and gender requirements. So to meet the requirements for considering sex and gender in research, applicants must present a clear evidence-based rationale explaining how sex, gender, or both have been accounted for across the research lifecycle. And this must include appropriate evidence-based rationale for the sampling approach, clear justification for any inclusion and exclusion criteria, and appropriate plans to conduct disaggregated analysis by sex, gender, or both as appropriate to the sampling strategy. Now, this is in addition to the current inclusive design assessment criteria that has been in place since 2024. What's important to note is that applicants must address both sets of criteria, so the inclusive research design criteria and the sex and gender criteria, and these cannot be traded off against each other. And then just finally moving on to the monitoring stage of research. To ensure compliance post-award, researchers will be asked to report on both inclusive research design and sex and gender elements during the progress reporting mechanism. So NIHR will be reviewing progress of research projects against their plan and reviewing any issues and their impact. And as before, throughout this process, we'll take a continuous learning approach and respond accordingly to ensure these changes can be applied effectively. So hopefully that gives you an overview of what these requirements are and what we're expecting of applicants. What I'm now going to do is hand over to Liam and Becky, who will introduce themselves and talk about sex and gender terminology and also how to embed sex and gender in the research lifecycle.
Thank you, Emma. And hi, everyone. My name is Liam Bishop. I'm a Diversity and Inclusion Officer the Leeds Institute for Clinical Trials Research, University of Leeds. My pronouns are he, him. And I'm also an RSS advisor on the RSS Hub delivered by the University of York partners in equality, diversity and inclusion. So I'm advising researchers like yourself on these changes, but I'm also a researcher too. So I'm going to be implementing these changes in my work. And what I think we need to do is think critically and constructively about EDI, and in this case, sex and gender, so that we can develop inclusive research. So I'm going to try and do this with you now so that you feel ready to do it in your work. Firstly, I'll take you through some terminology. And terminology is really important because we need to be using these terms, sex and gender, appropriately. And we all need to be clear on the difference between sex and gender so we can account for them in our research to build it inclusively. Next slide, please. Thank you. So let's start with sex. Sex means more specifically the biological characteristics observed in humans and animals. This means that we often see people categorized as male or female. So if we are studying sex, we might be looking at sex chromosomes, hormone profile, gene expression, secondary sex characteristics, or internal and external reproductive organs. There are also variations of what you might consider female typical and male typical characteristics. And these are sometimes known as variations in sex characteristics or intersex. There's a full glossary in the guidance on terminology. But if you want to be funded by the NIHR, you're going to have to report on how you've accounted for sex characteristics, which means stating how the data has been determined or recorded and whether it is specific to the attributes that I've just listed or not. What is being studied determines what needs to be accounted for in relation to sex. So in a cancer trial, for instance, it is reasonable to think that sex and biology will be a contributing factor on the pharmacology of a drug due to its biological nature, where gender might not. And if we go to the next slide, we'll see why that is. Because gender, when we're talking about gender, we're talking about identity. We live in a society amidst a range of social and cultural forces. Some of them are conscious, some of them are unconscious, and they influence behaviors, perceptions, and how people are treated. Gender is therefore a system of classification based on socially constructed ideas about masculinity and femininity. So this means gender can be more fluid, it's not binary, it exists on a spectrum, and it can change over time. And it intersects with other aspects of identity because of how it influences and is influenced by how we interact with the world. So when considering gender for the purposes of research, you'll need to account for specific gender characteristics of research participants. So if you think about that cancer trial again, a gender in relation to the pharmacology of a drug might be considered a bit too much sensitive information to be collecting. But if we're studying the psychological impacts of cancer, this is where we might want to put in place a more specific strategy for gender. In all instances, it should be careful and considered choice around what data is collected. But hopefully, it is a little clearer now what the differences are to sex and gender and why it's vital not to conflate them or use them interchangeably. I'm going to hand over to Becky.
Thanks, Liam. My name is Becky Barnes. I'm the lead for equality, diversity and inclusion across the NIHR Research Support Service, and I'm also a senior qualitative advisor at the RSS Hub delivered by the University of Leicester and partners, and my pronouns are she, her. So we're going to move on now to think about some practical guidance on how you can account for sex and gender when you're developing your funding application. And we'd particularly like to thank colleagues who've offered some constructive feedback on this part of the webinar, and that's Katie Biggs, Claudio De Larito, Chloe Gall, Chris Newby, and Martin Williams. So we've developed this diagram which shows the key phases of the research lifecycle, and this closely aligns with the RSS EDI toolkit. And we're next going to talk through each of these 8 stages and how you can account for sex and gender at each stage. So next slide, please. So first off, we're starting with thinking about your research question and rationale. And so when you're thinking about these background sections of your application and designing your study, it's really important to account for sex and gender in your research problem and to decide whether it is sex and or gender that you need to be referring to consistently in your application. When you characterise your research problem, ensure that your discussion includes any pertinent inequalities, differential experiences or outcomes related to sex or gender. Now, you might be thinking that your focus is actually a different underserved group or a wider population, and that you don't want to focus specifically on sex or gender. But sex and or gender are always going to be important intersecting identities to account for. So, for example, a study might be focusing on one or more forms of neurodivergence, such as autism, but intersectionality with sex and or gender will be important to consider in terms of how they impact on presentation, diagnosis, the effectiveness of therapies and support, and experiences of care. Now, as the policy outlines, there may be reasons for your proposal to only focus on one sex or gender group, even though it's anticipated that that will be a less common direction to take. If you're going to propose this, then make sure that you give a clear evidence-based justification for why you're only focusing on a single sex or gender. An example might be that you're focusing only on men or women due to evidence that an existing, for example, mental health therapeutic intervention doesn't meet the needs of a specific gender group. The applicant guidance has got a section that provides multiple examples of appropriate justifications. Next slide, please. So we're moving on to think about building your research team now, and it continues to be the case that team diversity on research applications isn't assessed as part of NIHR's research inclusion requirements. At the same time, though, it's still valuable to recognise the benefits of working in a diverse team. What is assessed is the strength of your team, and that could include whether the team has the appropriate expertise and skills to conduct inclusive research and involvement activities, or to engage with specific underserved groups. So it's a good idea to show your track record of conducting research or patient-public involvement and engagement with the target groups. Your team members may need cultural competence and unconscious bias training. And it's worth noting here that when we think of cultural competence or cultural humility, sometimes the focus is quite focused purely around ethnicity and faith. But it's important to think about cultural competence as cross-cutting across other identities as well. So, for example, it should ideally include understanding trans people's lives and being aware of terminologies, practices which can trigger gender dysphoria, make trans people feel unsafe, and experiences of discrimination. Being aware of unconscious bias is also critical to ensure equal opportunities and challenge sexist or transphobic exclusions, assumptions, or practices. Next slide, please. So we're moving on now to think about involving people and communities. And this is something that should be embedded throughout your research project from the earlier stages through to thinking about knowledge mobilisation. Patient and public involvement and engagement, or PPIE, will continue to be assessed by the existing people and communities guidance, but you're encouraged to think about whether and how your PPIE activities will include people of diverse sexes and or genders, and how you'll make sure that activities are safe, inclusive, and culturally sensitive. So a few pointers then. So when you're recruiting public contributors, avoid relying on avenues that might exclude people with marginalised or intersecting sex and gender identities. Consider some of the barriers to involvement and engagement for underserved sex and gender groups. These often arise in the intersections with other identities. Barriers could be practical, financial, cognitive, linguistic, or cultural. For example, are meetings being held in buildings or areas that might feel unsafe? Are there childcare facilities, or is there budget to meet childcare or respite care costs? Do some activities need to be single sex or single gender, or does consideration need to be given to the gender of the facilitator? The methods of engagement and involvement that are used could be more attractive to a particular sex or gender group. For example, community engagement via sewing or patchwork might be an excellent way to engage some groups of women, but might not appeal to men, might not indeed appeal to some groups of women either. So having a range of different activities and approaches is important. It's also really key to make sure that involvement activities are a safe space for all, and this requires some understanding of the sensitivities related to mixing people from different groups and different identities. So it might be that a group of predominantly cisgender people wouldn't necessarily be a safe or accepting space for a trans or non-binary person, and that needs to be considered. This might be particularly pertinent when it comes to certain areas of lived experience, such as pregnancy. Public contributors and community organisations may also need training on cultural competence and inclusive practices, especially if diverse sex and gender identities might be less familiar or visible to some people. Next slide, please. So we move on to sampling now, and when it comes to sampling and recruitment, you will need to justify any sex or gender specific exclusion criteria, justify your sampling strategy, and explain how you'll implement inclusive recruitment practices to make sure that you recruit a diverse sample. That includes in relation to sex and gender, but in relation to other characteristics too. As with research inclusion as a condition of funding, the policy seeks to eliminate arbitrary exclusion criteria that result in the recruitment of less diverse samples. The automatic exclusion of females of reproductive age from many studies has contributed to the significant exclusion of women in many areas of particularly clinical research. Although there might be issues around risk and insurance to navigate, these aren't insurmountable. If there are clinical reasons why sex or gender-based exclusions are necessary, these should be clearly evidenced and explained. When considering who to include in your sample, decide whether your sample needs to be representative of the whole population or representative of the target population affected by what you're studying. So, for example, patients newly diagnosed with Parkinson's disease. It might also be the case that you decide to oversample from one or more groups. So you might be studying a condition or issue where 80% of those affected are women, but you may decide that men should make up more than 20% of the sample in order to improve understanding of their needs or outcomes. This is pertinent for studies analysing routinely collected or big data too. The policy reinforces the existing expectation that researchers will collect relevant demographic data from participants or data sets to include sex, gender, or both. I'll now hand over to Liam, who's going to talk a bit more about how to approach this as well as the other phases.
Thanks, Becky. And yeah, I'm going to take you through the next parts of the research life cycle. And I'll start with data collection, because when we're thinking about data, we need to be thinking about the demographic data that we collect, as well as the data that we collect from our interventions, because the interpretation of results will be affected by how you apply sex and gender in your research. So we need to develop sensitive approaches to collecting data, and we need to think clearly about the data it is that we need to collect. So in some instances, people might not trust us or be concerned about the data we're collecting. And so for us to assume that this is now about simply collecting as much data as possible about these groups, even with the best intentions, that could be a cause of concern. Trans people sometimes face violence and prejudice because of the knowledge or assumptions people make about their gender. And so for us to be collecting a lot of data about them could inadvertently lead them to outing themselves when they don't want to be. There's a big report that came out from the government last year about women's reproductive health, where a lot of women and young girls have been left in pain and undiagnosed for years. So if we're researching these groups, we have to think why they would want to trust us with their data, us as healthcare professionals and researchers, if they feel their condition, their gender, or their sex has not been taken seriously before. There's a couple of papers that go into a bit more detail that I've put on the slide and that I have a bit less time to do today, but it's also about knowing the data that we need to collect for the interventions that we test. So assuming, for example, a focus group is the best way to collect quality data, and Becky's alluded to this. An open forum might not be the best setting, depending on the topic you're exploring, even if it isn't gender. An exercise intervention might not be appropriate if we don't consider how to make provisions for it to be inclusive, either in the conduct of the intervention or supporting mechanisms around the intervention. Next slide, please. And so how often is it we read a journal article and we sex presented as man and woman or gender as male and female, and we have no clear explanation by the authors why they've used the categorizations that they have. And there's been no need to provide any explanation because there's been no imperative to do so. But it's really problematic because it perpetuates a system where we use these terms incorrectly, or it perpetuates the belief that our results can be applied to a broad population and demographic when that might not be the case. Hopefully, the new guidance and policy is going to improve practice in this respect because it advises on disaggregating sex and gender in data analysis. So as per the guidance, you won't be required to produce statistically significant results for each characteristic or group where they're not part of the primary outcome analysis, unless the study, of course, is powered in that way. But the guidance does strongly encourage reporting subgroup analyses or summary characteristics. On this slide, you can see that we've emphasized pre-specified analyses of clinically relevant questions so as to mitigate any potential questions you have of data dredging. But either way, powered or not, you will need to include a description of how the data will be used and analyzed in the statistical analysis plan, which means thinking up front about how we apply these terms sex and gender. Again, I've referenced some more papers and they explore these themes in a little more depth, and they show the way forward in practice. I understand this will be a challenge, but we're continually learning what this does look like in practice. Next slide, please. And so in applications, researchers are going to need to start setting out knowledge mobilization plans and dissemination strategies relating to the requirements set out in the NIHR Journals Library. So now where there should be an appeal to you in developing robust, impactful, and inclusive research, hopefully there's an appeal in ensuring that our results are tailored to reach the diverse groups that our research included in its sample. Rightly, we're thinking about academic publication and translating results into practice. An exciting prospect, is it not, if it is inclusive of sex and gender? But I think broadly what I'm trying to inspire you is to not attempt to make assumptions about the groups you've involved in the research, about how they can be reached. As Becky said, not all women will attend sewing groups, okay? So again, there's another paper I've referenced, and that's not necessarily at the dissemination stage of research, because it's exploratory work informed the future of a randomized trial for a nature-based intervention to support mental well-being in pregnant young women. But you can see how the researchers are tailoring their approach to that specific group they've done the outreach with. And there's also a focus on making long-term connections with the groups as well. And next slide, and my final slide is on budgeting. So in the guidance, it says costs associated with developing, conducting, and disseminating research inclusively will need to be funded reasonably and justifiably as part of the award to ensure that you can embed research inclusion throughout the whole life cycle. So it goes without saying that it's about how we're going to cost everything that we're promising to deliver appropriately. Now that research inclusion is a condition of funding, though, and has been for the past year, hopefully you're starting to get a feel of what this looks like. But I think it is worth saying that there are some general principles around inclusive research that can be costed in. So without generalizing, of course, but childcare and respite costs for single parents, co-applicant expertise, Becky mentioned this from a trans person, or gearing your research to sites who might be less research ready, but have experience working with particular groups. Perhaps we can think about some examples that I've spoken about today. So in my slide on data collection, I spoke about this idea of historical mistrust. So we could cost in some specific training for our research teams to understand these issues in a bit more depth in their research development. Thinking about data analysis of presentation, I spoke about the disaggregation of sex and gender. So we could cost someone's time and experience in doing this to lead on that particular aspect of the analysis. And then when it comes to dissemination, we need to think about dissemination costs, but also the stakeholder costs too, to inform that dissemination. And so as I come to the end of the research lifecycle, I reflect on my role as a researcher and a RSS advisor. And I realize that this is challenging and difficult, but I know, and I speak to researchers all the time, we are all united by a desire to deliver the best research we can. And what makes it worth it is the people that I have in mind, and I'm sure you have in mind, that we know will benefit from the measures that we're implementing today. So if possible, let's see this as an opportunity for us all to learn more about health and its impacts across society in a way that we haven't done before. Thank you very much. And I'll hand back to Emma.
Thank you, Liam and Becky. So we're just going to finish off with a few final points before closing the session today. So we do recognise that accounting for sex and gender may be new to some, so this will be a learning curve for many. One question we got when introducing the inclusive design requirements was how much detail should be included in applications. And as with inclusive design, there's different expectations of what must be included at each application stage, with fewer requirements at the outline stage. Now, the quality of how researchers approach the sex and gender requirements, and our expectations around it will change over time as we go through that learning curve. However, researchers will need to justify their inclusion and exclusion criteria. So if applicants don't justify how they'll include sex, gender, or both in their design, sampling and analysis, funding won't be awarded. Now, importantly, the policy provides clear detail on how we expect researchers to use the terms sex and gender, along with the different sex and/or gender characteristics to consider when recruiting research participants. So this is what we'll expect to see in applications. Now, researchers aren't expected to cover all sex and gender groups. We will fund research that accounts for characteristics specific to one sex or one gender, but a strong justification needs to be provided in research proposals. And you can find a really detailed section in the application guidance about acceptable justifications. There'll always be compromise in relation to cost, time, and feasibility. And again, justification is key here. One of the things we really want to do is hear from researchers about your experience of applying the requirements, both the inclusive research design and the sex and gender requirements. So we've created a feedback form for this, and you'll find the link for the feedback form on the slides, but also in the application guidance itself. And finally, I just want to touch on the political, legal, and media climates on this topic. So whilst we do recognise that there are divisions in society and certain media narratives out there, just want to be clear that the NIHR policy focus is on underrepresentation in research. The policy takes an inclusive approach and focuses on all sexes and genders. Therefore, it's not excluding any groups. And as we've already heard before, understanding sex and gender differences increases accuracy, translatability, and reproducibility of research. So not accounting for sex and gender in research leads to untested assumptions. So ultimately, accounting for both sex and gender results in better science. And also, just to touch on the UK Supreme Court for Women Scotland judgment, just to be clear, we've sought and will continue to seek legal advice as appropriate, and the policy does not directly engage with the court ruling. So we're coming to a close now. So just to finish off, we've provided a list of further resources and support to help you with the new requirements. So this includes the application guidance and policy itself, along with details of NIHR's Research Support Service and the EDI toolkit, which goes into detail of some of the areas covered by Liam and Becky today. And there's also details of the free e-learning module on how to account for sex and gender in research created by the Message Project and mentioned previously. There's been a few articles mentioned and a few resources mentioned throughout the presentation, so we've provided a full list of references for this on this slide. And that brings us to a close. So thank you everybody for watching. We would really like your feedback on this webinar, so please do let us know your thoughts by completing our survey. So you can either follow the link or the QR code on the slide.